Heart disease. Exercise, jogging, new trends in diet, and an abundance of information are all reducing the rate of heart deaths. An awareness is developing that smoking, drinking, and eating in excess may not be the only causative factors in heart disease. Chronic anxiety states and stress may share equally in the overall causes. Maybe we should all take it easy and relax much more than we do. Is angina pectoris a heart attack? No, angina pectoris literally means a pain in the chest. It means that the heart muscle itself is not getting enough blood flow or enough oxygen. The difference between angina pectoris and a heart attack is that in a heart attack there is actual destruction of heart muscle cells, while in angina pectoris there is no destruction, but just a temporary reduction of blood flow and, thus, heart function. Should an attack of angina be thought of as a prelude to a later heart attack? A heart attack is an extension of angina. It's often a warning that one may indeed have a heart attack in the future. In fact, one warning that a heart attack might be approaching is when a patient's frequency of angina changes, that is, the patient develops more and more angina or finds that, where previously he or she could walk a number of blocks without angina, now it's changed. The patient gets angina after walking just a few blocks, or the severity of the pain changes. These things are often a warning that a heart attack may be approaching. If angina is experienced, is it because of a lack of access or ability for enough blood to get to the heart to nourish it? Yes, one of the unfortunate paradoxes, I imagine, is that a person's heart, which pumps blood all over the body, is not able to derive any nutrients or oxygen from the blood that it is pumping. The heart has its own blood supply and is derived from the coronary arteries. The coronary arteries are the first blood vessels that come off the major blood vessel that leaves the heart. So the first immediate blood goes to the coronary arteries, and these coronary arteries supply the heart. What happens to prevent the heart from getting enough blood? Well, with atherosclerosis, the usual cause of angina, the coronary arteries become narrow. Therefore, less blood is able to flow through the coronary arteries. When a person exerts himself or herself or becomes anxious, more blood is needed because the heart has to work harder, and if the narrowing of the coronary arteries is such that not enough blood is able to flow through the coronary arteries, then angina pectoris or even a heart attack may take place. Is angina a first-stage deterioration of access leading inevitably to a heart attack? Yes and no. Many patients have angina pectoris for years, do very well, and never have a heart attack. Other patients, unfortunately, have a heart attack as their first manifestation of heart disease. There is no warning in these people in the form of angina pectoris. Is angina reversible through change of lifestyle or diet? Can the vessels be opened as before? That's a good question. It is something that's not clearly discernible at the present time. People and physicians think that changing one's diet, changing one's lifestyle, or starting an exercise program will lead to a reduction in the incidence of angina, preventing the occurrence of heart disease. Whether this is putting a balloon into the arteries and blowing it up against the walls be an effective deterrent? Can you explain how it works? A catheter is placed through a blood vessel. Access is usually gained through a blood vessel in the arm or groin, and it is threaded under a fluoroscope into the heart and into a coronary artery. Before this is done, a patient must have an X-ray to show exactly where the obstructions are. Certain types of obstruction can simply be pushed out of the way by putting a catheter where the obstruction is and blowing up the balloon, which pushes the atherosclerotic plaque into the wall of the artery. This is a new technique and is still investigational and available at only a few centers. It's usually done on a patient who is about to have open heart surgery, that is, coronary artery bypass surgery. This is attempted first. If it fails, since the patient is in or near the operating room to begin with, surgery is begun. Why is it that some surgeons believe the surgical approach to heart disease ultimately is the easiest and the best way to treat a heart problem? There's no question that coronary artery bypass surgery makes a patient more comfortable. The vast majority of patients become free of angina after surgery. Their management therefore becomes easier, they don't need medication as often. They can go about and live a full life after surgery. Is that why surgical treatment is often preferred over medical treatment, because you are no longer dependent upon medical drugs for a long period of time? Yes, although after surgical procedures patients are often in need of drugs anyway. It's not that clear. It has been suggested by you and others that certain psychological states, anxiety, and day-to-day stress can bring about a heart attack. Can you comment on exactly why and how this affects the heart? There is a suggestion that there is a correlation between chronic anxiety states and an increased incidence of heart disease. What has to be considered is the amount of blood and nourishment that the heart requires. We are set up in such a way that when faced with a frightful situation, the autonomic nervous system, particularly the sympathetic division, secretes adrenaline. Adrenaline makes the heart beat faster and stronger and increases the blood pressure. It also makes you more alert, more aware of the surroundings, and better able to deal with a danger. When faced with a danger, with the adrenaline flowing, we are ready either to fight the danger or to run away from it. In that kind of situation, once the danger is dispensed with, the need for all the adrenaline is gone, and things relax back to a steady state. The heart can relax a bit, slow down a little bit, and the blood pressure goes down. All of this is needed to pump a lot of blood into the brain so that we are alert and pump a lot of blood into our muscles so that we can run or fight. With anxiety states, unfortunately, the danger is not as real, and anxiety states last longer. They can last for months and for years, and throughout this period of time the heart is working harder than it has to. It's beating faster than it has to, and the blood pressure is higher than it has to be. This means that the heart needs more blood flow, more oxygen, and more nutrients. Many people have obstructions to their coronary arteries and don't know about it. If this is the case, this kind of anxiety, chronic anxiety, can lead to earlier angina, coronary heart disease, mainly influenced by psychosocial and behavioral circumstances. Studies have documented that the loss of a spouse has been found to shorten the survivor's lifespan. This type of loss seems to indicate a vulnerability to coronary heart disease. Survivors who remarry or move in with someone else have been shown to be much less vulnerable to heart disease or death. Are there any effective drugs that can help heart attack situations? A drug called streptokinase, which was approved by the Food and Drug Administration for hospital use in 1982, is reported to be very promising. This is a clot-dissolving drug and is identified by a University of California medical researcher as being one of the most remarkable and dramatic advances in coronary care in years. This is an enzyme that is injected into the clot with a catheter, a thin tube put through an artery to the heart. Not too many hospitals in the United States can provide this procedure at the present time. Why do they say that nitroglycerin put under the tongue gets through the system faster than when it is simply swallowed? The trouble with swallowing nitroglycerin is that, unless very high doses are taken, very little gets into the bloodstream. Nitroglycerin is immediately metabolized by the liver, and everything from your stomach and intestines goes to your liver before it gets into your system. Putting nitroglycerin under your tongue avoids part of the circulation that takes blood from your intestines to your liver. And not only that, but the delay of getting the medication into your stomach and intestine is avoided by putting it under your tongue, so that nitroglycerin starts working in maybe 30 to 45 seconds. How does nitroglycerin work? Does it dilate the artery? That's a good question. There are two schools of thought on how nitroglycerin works. One school of thought says, yes, it dilates the coronary arteries and therefore allows for more blood flow through the coronary arteries. People speak against that theory because patients with coronary artery disease atherosclerosis already have rigid blood vessels, and it's hard to imagine how these rigid blood vessels can dilate. But people who say that think that nitroglycerin works indirectly by reducing the amount of work that the heart has to do. Nitroglycerin does this by reducing the resistance to blood flow, and therefore the heart has to do less work. Since it has to do less work, it needs less oxygen and less blood flow, and the angina pectoris attack is eliminated. How is atherosclerosis detected by the physician? Often it is not detected. Atherosclerosis is often clinically silent. Unless the patient has some symptoms, it is difficult to detect. Occasionally, a patient will have an abnormal electrocardiogram or some other manifestations of atherosclerotic heart disease on physical examination, but unless a patient has symptoms it is difficult to detect. Is angina pectoris detectable on a cardiogram? If the cardiogram is taken while the patient is having an attack of angina pectoris but after the attack is over, the cardiogram can often be normal. How recent has the emergence of new surgical techniques been in the treatment of the heart? And why is there a medical controversy about some of the newer surgical methods? I imagine that even in the 1940s there were certain techniques that were done to try to increase blood flow to the heart. I am very conservative, that is, I may send fewer patients for surgery than some of the other cardiologists do. I think the accepted criterion in this country today for coronary artery bypass surgery is a patient who has angina pectoris that does not respond to medical therapy. Despite all medications and changing lifestyle, the patient is still compromised by angina pectoris. That is an indication for coronary bypass surgery. Another indication for coronary artery bypass surgery is someone who has a certain critical lesion in the coronary arteries, the so-called left mainstem coronary artery obstruction. These people have been shown statistically to live longer if they've had surgery than people who've had the disease without surgery. But it's a relatively rare situation. Depending on which series you read, maybe 3 to 5% of all patients with angina have a left mainstem coronary artery obstruction. We often read about individuals suffering sudden heart attacks upon hearing bad news. Is this an example of extreme stress having an effect? It's acute anxiety. Whether or not a patient has underlying chronic anxiety I'm not sure is that important. Unfortunately, it's not unusual to have a patient who suddenly has a heart attack or even dies upon hearing shocking news. The news doesn't have to be bad news, it could be excellent good news. Since anxiety is a psychological cause that can lead to heart attacks, would taking up meditation or Eastern philosophy be helpful where an indifference to worrisome matters often evolves? That, again, is controversial. It's really hard to study these things. No objective data can really be obtained. There is some thought that people who live in less complicated, less sophisticated societies are less likely to have heart disease. Unfortunately, these people live in areas where the economics are such that people die from other things first. They die from infectious diseases such as tuberculosis, and their life expectancy isn't long enough to develop heart disease. So the answers to these questions are not clear. What is ventricular fibrillation, and can it result from anxiety? Ventricular fibrillation is chaotic contractions of the muscle fibers of the ventricles, the heart's main pumping chambers, and it is one of the most dangerous complications. Blood stops going to the brain and other vital organs, and sudden death ensues unless circulation is restored in time, usually about 5 minutes or more. There are many indications that, along with other well-known factors connected with heart disease such as smoking or obesity, mental and emotional stress is affecting the heart. Is it all that it's cracked up to be? Some reports claim that jogging causes faster aging and makes the face sag. Is any of this true? There's no question that it feels good to exercise. I myself have exercised and get a good feeling after running around the block a few times. Unfortunately, my knees have not allowed me to continue. Again, there are no good statistics to prove that being in good physical health whether by jogging or other strenuous exercise is good for you and lets you live longer. There are some data to suggest that, if you are in good shape and you do have a heart attack, you are less likely to die from it, but for preventing attacks, the data are not in. The data that are in so far are not clear. Are all of the people around the country who jog every day doing this out of some misapprehension? Are they being misled? Are they doing this with the idea that they are going to strengthen their hearts? Many of them do think that. One of the things that is unclear is that people who are in good physical shape often don't have the other risk factors. A jogger who runs a number of miles every day doesn't smoke, watches his or her weight, and is unlikely to be obese. Since this jogger has the time to do these things, he or she is less likely to have a type A personality. Some well-known doctors who have had heart attacks have written books about their own jogging programs and the excellent results that jogging has given to them and others. Does this mean anything? Again, it's selecting out the type of person who is willing to do this type of work. And it may be that other risk factors are eliminated in a jogger so that the reason why they do better, as I said before, is because they're not smoking, they're losing weight, and they're more relaxed. These things are very important as well. Whether or not it's the jogging per se that reduces the incidence, whether the incidence of heart disease is even reduced at all, is not clear. One of the smoking clinics correlates a pack of cigarettes with the equivalency of 60 pounds on the heart. Does this add up? I haven't heard that, but it sounds very reasonable. When a person is overweight, is that fat that actually surrounds the heart? People who are overweight are more likely to have high levels of blood lipids. Not only that, But the extra weight that a person is carrying around means that the heart has to do more in simply carrying around the weight, plus all of this fat has a blood supply. So there is a greater area, more tissue that your heart has to send blood to. Why do we call the heart attack a disease? We usually think of disease as something one contracts, such as tuberculosis or venereal diseases. That's a good thought. I guess if you assume that most of us are destined to die from heart disease if something else doesn't get us first, in that sense it's not a disease. It's just part of the natural aging process. Unfortunately, some young people have coronary artery disease, while other people can live to be 100 and have perfectly healthy hearts. So it doesn't mean that all of us are going to get it. The face wrinkles as we age. Does the heart also age? Actually, in findings from a 25-year study of 80 people between the ages of 20 and 80, about half of them over 60 and all in good health, it was concluded that 40% of older Americans have hearts that are as healthy and strong as those in the younger range. Lack of exercise, smoking, and poor diet are the real culprits in age-related heart decline. The study did reveal that as the body ages, the heart beats less but compensates for this by pumping more blood per heartbeat. Is drinking milk harmful to the heart? There has been some research in this area by Dr. Kurt Oster of Fairfield University, Connecticut, in which he reports that an enzyme in homogenized milk xanthin oxidase, XO, causes fatty buildup in the arteries. And, most recently, the findings of a 10-year study by the National Institutes of Health reported that cholesterol levels correlate with reduced percentage in coronary heart disease for 20,000 people from 20 to 74 years of age. The drug called cholestyramine, which alters cholesterol levels in the blood, was found to be very effective as used in this survey. How quickly should one return to work after a heart attack? Again, a 10-year study found that heart attack subjects who go back to work quickly have a lower risk of dying within 1 year than those who don't go back to work. Data from this study also recommended exercise within 3 weeks of an attack. Of course, this was a study with 1,000 patients, and individuals most certainly should check with their doctors before taking any independent action. Is there a moral issue connected with heart transplants? Are the hearts of pigs, sheep, and chimpanzees being transplanted into human beings as reported in some publications? To my knowledge, there is no program now where animal hearts are being transplanted into human beings. But there are programs still in existence where a heart is transplanted from one human to another. The big problem with the transplants is not so much the mechanical problem of actually transplanting the heart. The big problem is the immunology. The body wants to reject foreign tissue, and an animal's heart is more foreign than another human's heart. Is there any connection between atherosclerotic heart disease and poor circulation in the legs with severe cramps in the lower legs and feet at night? The circulation to the lower extremities is often compromised by the same process that compromises circulation to one's heart. But just because you have one doesn't necessarily mean you have the other. If you do have heart symptoms or poor circulation as described, would that indicate that you have an atherosclerotic heart? Certain types of heart symptoms would be highly suggestive of atherosclerotic heart disease. And the symptoms are simply angina pectoris or a heart attack. Are swollen ankles a sign of heart disease? If you have been standing a lot with little movement, ankles are known to swell from this. Ankles also swell in heart disease, but usually symptoms are more stark. People who sit for long periods and whose circulation is not too good, the elderly, for example, may accept swollen ankles as part of the problems of growing old without understanding that in some instances it may be the signs of a heart problem slowly developing. As a precaution, one should see a doctor if the swelling persists or is located on one side only. Should one be concerned by heart fluttering, and is that the same as heart palpitation? Yes, it's the same. Whether one should be concerned depends on exactly what's going on when you're feeling your heart flutter, and you should have your physician check it. Regarding jogging and other aerobic exercises that raise your heart rate, isn't that effective in strengthening your heart? And doesn't the exercise produce high-density lipoproteins that reduce cholesterol? Why do you downplay these activities? I'm not really downplaying, all I'm saying is that the statistics are not yet in. No one has been able to prove without a doubt that exercise is beneficial and prevents heart attacks. So many medical experts and doctors are recommending these activities as being a preventive. Where are they getting their information? It depends on how you look at it. There's no question that lowering your blood pressure, lowering your heart rate, and increasing your high-density lipoproteins are beneficial. The question is, does this then mean you're not going to develop heart disease? And that's the question that would take a long time to answer, because obviously the studies have to go on for years and years to find out about it. The final answer is not in. But these matters do eliminate risks, there is no question about that.